Member Campbell and Councilmember Janik, thank you for being here. Nice to see you.
Welcome. Thank you.
Thanks for being here, Councilmember Tilke. Gabe, thanks for joining us.
Morning.
Good morning, Councilmember Klein. Thank you for joining.
That sounds good. Yeah, we'll wait a couple minutes. Councilmember Tilke, we could have carpooled today from the AZ Sen breakfast. Thank you very much.
A little lot. I had a little Lhasa.
Sorry, Councilmember Klein, what was that?
Yeah.
Thank you, Kelly. Good morning, everyone, and welcome to the MAG Human Services and Community Initiatives Committee meeting for May 11th, 2023. And I think we'll get started here. If you could remember to basically turn off your mics, keep yourself on mute unless you have some comments to make. And you can raise your hand on the bar down below and we will get to you. So I think before we get started, do we want to take a roll call first? Make sure that we do have quorum, right?
We do have quorum, Chair.
Oh, great.
Thank you. Councilmember Wally Campbell.
Here.
Thank you. Vice Mayor Ali Klein. Vice Mayor Ali Klein. Vice Mayor Klein is present. Please let the minutes reflect. Councilmember Tina Condi.
Here.
Thank you. Vice Mayor Monica Dorsey. Supervisor Steve Gallardo. Councilmember Betty Janik.
Here.
Thank you. Councilmember Joel Navarro. Vice Mayor Bill Patana. Rachel Sanders. Vice Mayor Kathy Tilke. Vice Chair Jen Duff. And Chair Mark Stewart.
Here, thank you. Thanks, Kelly. Is there anybody that is new or is first time joining us or that we didn't call? All right.
Chair, I did want to make one announcement to get started, if you don't mind, if that's acceptable.
Absolutely.
Thank you. This is our chair, Mark Stewart, and our vice chair, Jen Duff's last meeting in leadership. So I thought we would take a moment to thank them for their service. We do have letters that have been approved by Regional Council for new leadership of the committee beginning in July. Joel Navarro with the City of Tempe will become chair, and Tina Condi with Avondale will become vice chair. So thank you, both Chair Stewart and Vice Chair Duff, for your service of to this committee. And we're looking forward to new leadership starting in July as well.
Well, thank you, Kelly, and thank you for all the work that you do. And for this committee as a whole, I think the discussions that we've had and the initiatives that we've created are making a difference without question. So I've been honored to serve with folks on this, but I'm truly excited about the leadership that Councilmember Navarro and Councilmember Condi will bring to this committee to continue to carry the torch into the next couple years and continue to make the difference that we're making. So we still have a lot of challenges in front of us, but I think if we continue to keep meeting like this, continuing to share best practices that we're using in each other's cities, and then hearing from community members and nonprofits that we're hearing from like today, I think we'll continue to make waves and help those that need it the most. So I think we'll move on to item number 2, which is called the audience. Unless Councilmember Navarro or Councilmember Conde, if you'd like to say anything real quick.
Thank you, Chair Stewart. I'm honored to be able to co-chair this committee, and I look forward to working with everybody and continuing the great work that's already been started. So thank you, and I look forward to seeing you guys next time, but as vice chair.
Okay, so we'll make a call to the audience right now. So there's an opportunity for public comment on the agenda. That agenda was provided ahead of the meeting. Staff did not receive any comments, so we'll move on to item number 3. I'll take a motion to approve the March 9th, 2023 minutes, unless there's any questions on those minutes. Okay, without hearing any comments or questions, I'll take a motion to approve.
Councilmember Condi, so moved.
A second from somebody, please.
Betty Janik, second.
Thank you. And please voice vote.
Aye.
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 Motion passes unanimously. Kelly, did you need to do a roll call vote? I think we can do voice of affirmation there. So great. So we had an action requested back on March 9th to hear more about community initiatives that are going on. And I think what we're going to move to forward is talking about building healthy, resilient communities with the YWCA Metropolitan Phoenix organization. They were awarded a grant by the Maricopa County Department of Health via the U.S. Department of Health and Human Services Center for Disease Control and Prevention to address health disparities that were created or worsened by the COVID-19 pandemic. The grant, Building Healthy and Resilient Communities, will examine barriers to accessing mental health services, race, gender discrimination against seniors and LGBTQ and young people of ages 18 to 24. Janice Scott, a good friend of mine, the director of the YWCA Systems Change Initiative, will present on this item and how regional communities can get involved to help their senior population. I'm grateful that you're here, Janice, so thank you, and the floor is yours.
Thank you, Chair Stewart. I would like to introduce my CEO, who will start us off in the presentation, Debbie Esparza, who's been leading the YWCA for over 4 years now and has such a great vision for how YW can really support the most marginalized and vulnerable women and people in our community. So Debbie, take it away.
Thank you, Jana, and thank you for allowing us to be here today. I really appreciated the intro and why this work is important and why this group would want to hear what we're doing, because the reality is this YWCA has been in the Valley for about 115 years, and folks still don't know what we really do. And so we'll share a little bit of that with you today, but we are really, with this change initiative, it really allows us to get further into our advocacy work and really trying to make change right in the systems and not just I don't mean just, but not only doing some service delivery. So next slide, please. As Jana mentioned, I'm Debbie Esparza. I'm the Chief Executive Officer, and I'm so pleased too that Jana has joined our team because again, this level of knowledge and experience is really what's making the difference in this initiative. Next slide, please. Our mission is complex, but it's not complicated. Our mission is very simple: to eliminate racism and empower women, promoting peace, justice, freedom, and dignity for all. And you would think that that's a really easy thing to do, but it's not. And so that's why we do a lot of different programs and activities and spend a lot of energy trying to make progress in a lot of different areas. I'll lead just briefly with our equity programs. These are workshops, and right now, we'll, as part of our presentation, we'll tell you about our racial justice challenge. We do learning sessions with organizations to help build equity in their organizations. Our systems change initiative, Jana will tell you much more about that. We also have throughout the Valley, we do prosperity programs, and some folks refer to this as financial literacy, but that's, again, it's too narrow a focus. We're really trying to help women and people of color have that financial independence, and not just with the finance, but with wages, and really a focus now on health and wellness as part of what helps someone prosper. So really broadening that, and those programs are available throughout the county. Our senior programs have been in place the longest, about 40 years. We've been feeding older adults and the disabled in the Glendale area. We feed about 100,000 meals a year just in that space, both with home delivered meals, congregate meals. We have 3 congregate dining rooms open now, and then wellness calls, checking on that they're still safe in their home, if they have any other needs, like if they're about to be unhoused, if they're having a health crisis or something, that we can step in and get them the right resource. Next slide, please. I'm going to turn this part back to Jana because this is really the meat and potatoes of this important work, and that she is championing for us. So Jana.
Well, thank you, Debbie. And I also just want to thank Kelly because she has walked alongside these thoughts with us and others on the MAG staff for a while, helping us with data and helping us really tell the story. So we're very grateful to be here today, Chair Stewart, and have spoken with some of the staff in some of your cities. One of the things I did want to ask was, who are the cities that are here today online? Because we may be already working with you. So as we go forward, maybe someone could either do a shout out or raise their hand if their city is mentioned. But we're seeking to do this work through something called the elements of a healthy community. What we've come to realize is that there are societal systems that can impact a person's health and well-being all across the spectrum. So if you can see this wheel, and some of you may already be familiar with this wheel, we're looking at things like parks and recreations as having a huge impact on a person's mental well-being, environmental quality, access to care, affordable housing, and most importantly, social and community cohesion. Next slide, please. We do this through a lens of race and justice because that's what the county data has showed us, where there's the most issues in our county right now. And so as we talk about systems change, I don't think this is new to any of you as elected officials who have done so much in governing. You want to hear the ground truth from your constituents, and then you often use that ground truth to take a look at what does that mean for how you're making policy, how you're doing practices, what are the power dynamics in your community. And so that these social norms that often underlie the way we do business in our cities can really be improved day by day. And I know that Chandler, for instance, Mr. Chair, is a great example of that. So thank you for the work that you all are doing out there. Next slide, please. So just a little bit more, I think you heard from the Chair Stewart that what this initiative is about. So I won't repeat that, but I do want to acknowledge that policy, systems, and environmental change is key to what's happening in our communities now. You might remember the Surgeon General's recent report that came out last week. U.S. Surgeon General Murthy talked about isolation and loneliness is killing our people. And we know from the county's data that LGBTQ young people and elders of every race are disproportionately impacted by post-COVID issues. So that's what we're focusing on. Next slide, please. I just threw up a little bit of data. Maybe we'll send you this slide deck so that you can look at it yourself, but just a couple that I want to point out. One is related to our youth. 1 in 6 youth aged 6 to 17 experience a mental health disorder in every year. That's 87,000 Arizonans, 12 to 17. And that, of course, feeds into the unfortunate suicide rate on the next slide, if we can turn to that one, where we're talking about, on average in the US, 1 person dies every 11 minutes by suicide. And in Arizona, that's 1,438 lives that were lost to suicide, and over 230,000 adults who had suicidal ideation. And we think about this as one of the impacts of isolation and loneliness. If you ever do get a chance to read the U.S. Surgeon General's report, this data comes from one of our strong partners in this initiative, National Alliance on Mental Illness, or NAMI, and NAMI Valley of the Sun has been a strong partner with us, doing listening sessions in towns around the valley with us. Next slide, please. So who's involved? Aguila, El Mirage, Glendale, Peoria. Sun City and Sun City West are involved in a different aspect of this with some other partners, more so related to physical fitness and physical health. Surprise, Whitman. I'm headed out to Wickenburg today after this with our team to be with Vice Mayor Chris Henson and several others to do a listening session, and the town of Youngtown. So we have been talking with folks in these towns for the last 6 months, and we're grateful that we've been extended now on a contract amendment, and we'll be getting back to some cities and 2 others in the next year. Next slide, please. So what do we do when we work with these cities and the people they're in? We first start by building a container of key partners like NAMI, like Adelante, like MAG, like others who can really help us begin to craft the story of what it means to deal with post-COVID mental health issues in our towns today. And then we develop and leverage those partnerships to get to the people who are really impacted. That's where we talk about getting to ground truth. We've been acting as a convener and a thought partner. We are not a mental health provider, but we are bringing forth the issues that are important not only to the provider community and to people who are advocates for people suffering from mental illness, but also for those who are actually suffering themselves. And then finally, we collaborate with community partners and allies, not only to understand the issues, but then to amplify those issues and the voices of those most impacted. Right now, we're working with Aguila and Rising Youth Theater as one of our strong partners to do actually a mental health play with Aguila young people and adults around what does it mean to be suffering post-COVID from a mental health issue in the town of Aguila, one of our most rural communities in the county. Next slide. So we have an ask for you today, and that is to ask, and I'm going to ask the first 2, and then I'm going to turn it over to Debbie to ask the second 2. First is to acknowledge that racism, and I'm not talking about individual racism here. I'd love for you to come along with us in our journey as we talk about structural racism at YW. Racism that is kind of baked into the system, and genderism that's kind of baked into some of our systems. Things that maybe individuals aren't even aware of, but acknowledge that these issues are representing a public health crisis in our community. One of the prime examples is we're finding out that a lot of people go to their doctor, but because the insurance companies are paying doctors for a very limited amount of time, some people who feel like they can't speak up to tell the whole story of what's happening to them leave the doctor with issues that are unaddressed, particularly mental health issues. So now we've got partners like Adelante and even the city of Tempe who are beginning to talk about integrated healthcare as a way to get at that. Secondly, you are a part of the dialogue with us today. We're grateful for that, about what we can do to improve post-COVID mental health in our communities. Debbie?
Thanks, Jenna. And just talking about one of the places that she mentioned on the previous slide, much of our work in convening and creating awareness is shining the light on the great things that are happening, but shining a brighter light on the gaps. And we're learning more about those gaps with the ground truth and the convenings that Jana and her team are doing. So again, what we're asking for is for this group as well as others to really increase our own awareness about the reality of the post-COVID disparity with race and gender. Seniors of color and LGBTQ young people, we chose those two populations because they're kind of on both ends of the spectrum. There are disparities throughout the community, the population. We're finding that in talking with our young people and our elders, we're finding the families that are connected to them also needing some awareness and understanding how to access mental health services. The last act, it's an easy one. This racial justice challenge, it's one of our national campaigns. Every day you get information to learn about different elements. This week happens to be the focus on disparities in mental health. Our YWCA has also added information that's unique to Arizona, in addition to some of the national data. And we have made that available moving forward. It technically ends this week, but we will make it evergreen on our website and we will relaunch it because we know lots of folks have missed it. So we would ask you to check into our racial justice challenge as you go forward. Next slide, please. Again, as I just alluded to, week 4 is on mental health. This season's challenge had housing, disability, music, and mental health as the 4 themes for the 21 days. And you can see we've got some Arizona themes in this week's, as well as some of those national themes. So please join us there. Jana, did you have more to add on the racial justice challenge?
Just that it's timely that we're talking about this today because May is Mental Health Month. And we just know that whether it's talking about the effects of gender discrimination or racism or healing through culture, these are things that I believe our cities can have an important role in, not so much becoming mental health providers, but bringing the framework of environment and policy and systems into this realm. And that's why we're talking with you all today and really want to hear from you, because there is a nexus. It's not necessarily intuitive, but there is a nexus between what you do as governing cities and the well-being of the people that live in your cities. And you know that, I believe, but the strategies maybe be something where we'd love to help you think through that.
Thank you. Next slide, please. So one of the things, a couple of the things that Jana and her team is doing in just 6 short months is we've published an article, a research, a summary called Let's Talk Justice and Mental Health. We've got a link to that document available for you, but it really talks through the first 3 or 4 months of this work and how much more work there is to do. So we're grateful that we've been renewed for another year to dig a little bit deeper. But you'll please take a look through that. And again, we are open to moving to more than these 10 cities. This is just what we've been funded for at this point, but the model that we're using is replicable in many, many cities and many, many areas and many, many populations. So the picture on your left is one of the listening sessions with some of the elders at Gregory's Fresh Market. And they're telling us like it is, right? And how we can listen to help create better access and less stigma. Some of it's just about the stigma that, I don't want to tell somebody that I'm sad or depressed because people think things, but that's really what I might need to work on as a young LGBTQ youth or an older adult, so that I can feel better and get access to some other health care. Jana, back to you.
Well, next slide, please. We just want to be sure that you know how to reach us. Of course, through Kelly is the best way. But certainly if you want to take a look at our website or follow us on Facebook or any other social media. And also, this QR code is active. I think you can use your camera to sign up for our newsletter if you'd like. We are an organization that really depends on connections with people in community. We cannot do this work by ourselves. So we are so grateful to have been able to speak with each and every one of you, and would love to hear comments if there's still time for that, Mr. Chair, from any of the council people.
No, we would absolutely love to have a little deeper dive into this. And so I'll turn it to the floor. First of all, Mrs. Sparza and Jana, thank you so much for that presentation, and more importantly, for the work that you're doing. I think recognizing some of the gaps is something that, you know, folks that come in here are always talking about, but you recognizing it and focusing your efforts on a particular area to create that change is extremely important. So without talking too much here, turn it over to the floor for questions and comments. See any hands, Kelly?
I do not, Chair.
Well, very thorough. So
Well, could we at least find out what cities are online with us?
that's a great idea. We want to start doing some shout outs here from left to right, the top.
Well, we do know Council Condi from Avondale. So good to see you again. We worked together on the census.
Yeah, that's Campbell is from Goodyear.
This is Betty Janik from Scottsdale.
This is Jen Duff from Mesa.
Good morning, Kathy Tilkey from the town of Gilbert.
Allie Klein from Surprise. I think you guys are working with Seth Dyson's Resource Center.
We actually are, and we are actually going to be working with some of your staff members out there to do a town hall in the coming fall. So we're very grateful for the opening in Surprise now. Thank you.
Perfect. Thank you.
Good
We've
morning. This is
been-
Sarah Town. I'm
Jen,
sitting next to
sorry.
Councilman Joel Navarro for the city of Tempe.
Oh, Tempe, great. I think that was everyone. I did just want to say with Surprise that we're going to be with 1 in 10 in Surprise on Monday, doing a listening session with young people. So we're very grateful for the inroads that we've had there. And this is great to know that we've got towns from both East Valley and West Valley on this committee, and of course Chandler. And anything we can do to engage and continue the conversation around these issues on how mental health and mental well-being, I should say, is being impacted post-COVID. We're more than happy to do that one-on-one or with your staff people. We don't want to continue to take up time on the MAG agendas, but we've been so grateful for today's time. And Debbie, if you want to say a few
Final words are thank you again so much for allowing us today. We did bring some party favors. I'm known for, you know, don't show up empty handed. So those folks that are in the room, Mr. Chair, you get the full set. We'll find a way to get the sticker. This sticker is our this month's sticker, Protect Your Peace. Again, we do these monthly to promote different things. Our little pad that's until justice just is. That's how long we got to do this work. And then a couple of flyers on more about our programs, our impact report, ways to get involved, just ways to open up conversations. So we've left a little swag bag and the pen, all these fun things so that you don't forget about YWCA. Thank you.
Thank you very much. We're certainly grateful for that information, and that we'll make sure to get your information out to the rest of the team members here. So, all right, folks.
bag to Chairman.
Oh, thank you very much. Y'all are missing out. Y'all are missing out. This is delicious water. So, and we have coffee too. Anyway, that'll be up to Joel and Councilmember Conde to get you all here in person. So we're going to move on to item number 5. The city of Avondale has been doing some tremendous things as it relates to homelessness, and Avondale staff will present the city's successful approach to working with individuals experiencing homelessness in their area. And I think that they are centered on ensuring that homelessness is rare, that it's brief, and most importantly, non-recurring. So we will turn the floor over to Avondale team for a presentation on the work that they're doing.
Good morning, Chair Stewart, members of the committee. Thank you for that wonderful introduction. We're grateful to be here this morning to talk a little bit about how Avondale is serving those experiencing homelessness and really the work we're doing to prevent homelessness. My name is Chris Lopez, and I'm the Director of the Neighborhood and Family Services Department here with the City of Avondale. I'm also joined by Lieutenant Brandon Busey, who's with our Avondale Police Department. And I can't emphasize how important, how critical a partner they've been in our effort here. So before I jump into it, that first slide that you see there is an image that depicts our fairly new Avondale Resource Center, which houses most of the services being offered. It's a one-stop shop for health and human services that serves the Southwest Valley. Next slide, please. Avondale's long had a holistic approach to preventing homelessness. And really before jumping in to talk about our homeless services, I think it's important to highlight the entire department. We currently have 6 divisions, which include the Family Services Division, Senior Services, Youth and Community Engagement, Housing and Community Development, Libraries, and our newest division, which is Homeless Services. Each of these divisions create a holistic net of services that help keep people out of crisis and really help families and individuals thrive in our community. So there's a lot of work that happens really to prevent people from ending up in a crisis and ending up unsheltered. Next slide. As Chair Stewart mentioned, our city's goal is to make homelessness rare, brief, and non-recurring by providing leadership, coordination, planning, and the mobilization of resources across our community. Next slide. This effort can't be done alone. We've been working in concert with MAG and all of our neighboring communities in the creation of the Pathways Home, the Regional Action Plan. And as I run through the presentation, you'll see the correlation and connection to each of these action steps. We definitely have a commitment to working regionally to address the issues of surrounding homelessness. We're working diligently to increase safe housing options, and I've got some examples of that. And then we're also supporting diverse partnerships that address homelessness and some of the underlying causes of homelessness. Next slide. This is something really exciting for us. In 2022, the City of Avondale established a new Homeless Services Division within the Neighborhood and Family Services Department. And this was greatly due to the support and the impetus provided by our mayor and city council. Really, they've had a tremendous focus on health and human services and saw the need early on to equip my department with the resources we need to serve those struggling in our community. The division consists of 5 positions, again, supporting that goal of making homelessness rare, brief, and non-recurring. We also wanted to make sure that this team was well-rounded and that they're recognizable in the community. We want them to be seen as a beacon of hope, and as a place that folks can go to get resources and connection to shelter. So we've created a really wonderful looking vehicle that's out in our community on a daily basis. We've also branded the team as Sonar, which is our street outreach, navigation, and resources team. Next slide. Next slide, please. Can you see the next slide? I'm sorry.
Chris, is it frozen on your end? It is advancing on ours.
Okay, here we go. Thank you.
You're welcome.
This is an overview of the team or the division. We have a homeless services manager who's really responsible for the coordination of our citywide effort. And then we have a multidisciplinary array of folks that are focused on outreach, housing solutions, and interventions regarding behavioral health. Next slide. This slide indicates our division priorities for the upcoming year. Data collection is going to be extremely important, and we're developing new mechanisms to gather data and to report that data to our electeds. Since formally establishing the division, the team has made significant strides in these areas. We definitely want our reporting and data collection to align with the regional effort and establish best practices. The city has developed a data collection process that will allow us to measure the work that our team is performing and help inform some of our decision making. We're also focused on service coordination and establishing new partnerships. We continue to evaluate for gaps and seek to establish new partnerships to address those gaps. With that effort, we're in the process of selecting a consultant to help us develop a 5-year strategic plan. We're just wrapping up our previous plan, and we've accomplished everything that was in that plan, but we really want to take that to the next level and determine, what we can do to continue to enhance services. And then something that's very exciting, and I'll talk a little bit more about it later, is bridge housing for families. We have a RFP out on the street. I think that's going to go live here in a couple weeks. To identify a developer to help us build 6 family bridge housing units. Next slide. Again, regional data is really important to us. Our team has recently been approved and trained to utilize the HMIS system, and that's allowed us to be an access point for coordinated entry. I believe we're one, if not the only community in the Southwest Valley that's able to do that. And then we also have City of Avondale specific data. We're working on developing a dashboard that'll be visible and available to the community. We're actively tracking our outreach and engagement data. We're also interested in understanding and keeping track of shelter utilization. We want to make sure that whatever assets, shelter assets we bring online are being fully utilized. And so we want to make sure that those beds are full every day. And then we have our AviWise CRM. This is our mechanism for residents to put in requests whenever they see issues in our community. They observe possible homelessness encampments, things of that nature, and that allows us to communicate with them and to respond in a rapid manner. Next slide. This is just a snapshot of our preliminary data report that we're sharing with city management. It's pretty standard data that a lot of cities utilize, and that comes from HMIS. We're looking at new contacts, active engagements, exits, and then folks that may return to homelessness. We're also tracking exit destinations, whether they're placed in shelter, temporary housing, permanent housing, or in some cases we're not sure. And then again, I mentioned shelter utilization. We're tracking that closely. We're tracking number of bed nights, and the frequency that those beds are being used. And the last piece is really the human element. We want to be able to communicate victories and share those with our leadership. Next slide. Some of our significant accomplishments are we recently adopted an administrative policy that allows us to address encampments in a compassionate fashion and with some consistency. We're also developing new partnerships. We've had a partnership with Phoenix Rescue Mission for outreach that enhances the work that our sonar team is doing. We work closely with Community Bridges for outreach in river bottoms and unincorporated areas. They also provide a significant array of mental health, behavioral health services. And then we work with HSC in a regional effort and adds capacity. And then something else that we're really excited about is we brought back Project Connect. It's kind of fell by the wayside for a number of years, and we work closely with the Human Services Campus and our interfaith community to bring back Project Connect. And so we conducted a Project Connect in 2022 with over 150 individuals engaged, and we're currently in the process of planning for next year's. Next slide. Service coordination is extremely critical. We do that across all our various departments. So we have bi-weekly meetings with nearly every department represented, including our city manager's office. So we, at each meeting, we have representation from city manager's office, and most of the time it is our city manager who's in those meetings. Extremely critical because we all are involved in serving the entire community, and each of these departments has a role to play in making sure that we're serving all of our neighbors. And then again, community partner coordination. We have monthly meetings with our core partners. And then we work really closely with our interfaith community, who's doing tremendous work to serve our most vulnerable neighbors. Next slide. Some new programs and activities that we have underway. We just established an agreement with a new leaf for family navigation. This is really building capacity and getting ready for the construction of our bridge housing units. So a new leaf will be doing housing navigation and connecting with McKinney-Vento liaisons in our schools. And that'll be the conduit that'll connect families to the bridge housing and make sure that they have the wraparound support that they need. I touched on this earlier, but community visibility. We want to make sure that the community understands our approach and is well informed, and that they recognize our sonar team when they see them out on the street. So we put a lot of effort into branding this team, making them recognizable, and then making sure that we're out in critical areas in the community. We have our sonar team with specific office hours at our libraries, food banks, and other partner agencies in the Southwest Valley. And then we have a healthy giving campaign where we're encouraging folks to give to organizations that are making sustainable, meaningful differences in folks' lives, as opposed to giving on the street corner. Next slide. And we're currently in the process of reviewing proposals for a consultant to conduct a strategic plan for us. This will include a needs assessment, a variety of public forums and community engagement, collaboration with our interdepartmental work group, input from a variety of stakeholders, including those with lived experience. And our hope is to develop both short-term and long-term objectives going out to 5 years. And then probably, next slide, the most exciting piece for us is the design and construction of bridge housing for families. So we're looking at building 6 units that'll be approximately 600 square feet and serve families up to 5 persons per unit. We anticipate that this process will take anywhere from 18 to 24 months. And I'd be remiss if I didn't mention the tremendous support that we've had from Maricopa County. They've helped to provide funding to support some of our outreach and shelter efforts over the last several years. And most recently, we entered into an IGA with Maricopa County to generate funding that'll support the construction of these units. The image that you see there is a conceptualization of what those units could potentially look like. I also want to mention that the units will be designed and constructed in very close proximity to our Care First Avondale Resource Center. So a lot of synergy and great work can be done by having these units walking distance from our resource center. And then again, I want to emphasize just the coordination and effort that goes into our outreach efforts. We work side by side with our Avondale Police Department to make sure that we have a compassionate approach. Our approach is focused on compassion, resources, education, and health and safety. Avondale has balanced its response in a way that allows us to continue enforcing regulations to preserve public health and safety for all of our residents, while respecting the constitutional rights and dignity of unsheltered people in our community. This reasonable balance allows the city to effectively address the interests of all residents, both sheltered and unsheltered. I do have Lieutenant Brandon Bussey with me. Brandon, I don't know if there's anything you want to add.
No, I mean, I think the most important thing that we emphasize to our officers is that first word on this slide is compassion. So just, having our officers understand that at the end of the day, we are all human and have that compassion on every encounter that we have with the public and provide any assistance or resources that we can.
Thank you. And that concludes the presentation. We're both available to answer any questions that you may have.
Thank you very much. And that was very thorough, and, the work that you're doing is tremendous. And I think other cities around the valley are doing similar work, but does anybody have any questions for Chris? I know there's a lot to cover there. We have a bunch of hands up. This is great. So Betty, you want to start us off?
Yeah, thank you. I do have a couple questions. First of all, is this your first foray into bridge housing units?
Yes, this is our first foray. We are consulting with organizations that are familiar, but it's an exciting endeavor, but we know that there's going to be some challenges along the way.
Okay, thank you. Then I have two more questions, if it's okay. With the HMIS, the regional data system that you're using, is it specific to Avondale, or are you working with the whole region in cooperation to find services that would cross city boundaries?
Thank you for that question. So as a approved organization to utilize the system, the data is shared regionally. And so we're able to enter that data and identify resources available regionally and place folks using that regional system.
I think that's a great system. And then my last question has to do with behavioral health. How do you process or work with or try to improve those individuals who are having trouble with mental health? What is your referral system? What are the services you provide? Because as you know, this is a substantial problem with the homeless.
Yes, so our team does have a behavioral health technician on as part of that Sonar team. But we rely heavily on some of our community partners. So we work closely with Community Bridges and Copper Springs in our community, who really have the professional capacity to fully evaluate those individuals and get them connected to whatever resources they may be eligible for. But the first step is really working with our behavioral health technician to identify those symptoms and make sure that the appropriate connection is made.
Okay, thank you.
Thank you. Great questions. Vice Mayor Tilke.
Hi, Chris. Sorry, I couldn't tell if I was unmuted. First of all, congratulations. That it's a big undertaking for a city to take on, and it appears that you've invested quite a bit of money and training into this program. And if I understood right, some of it was funded through Maricopa County and maybe through some federal grants and funding to help you get started. I was curious about your numbers, and I know it went kind of fast, but I believe it said like 176 was that for a year that you had assisted, and I wasn't sure if you're focusing specifically on the unsheltered homeless, or are you also reaching out to those who, and I don't know the official term, so I apologize, but perhaps are couch surfing, or, they're right on the brink of being homeless? And if you could just kind of distinguish those numbers for me.
Sure. The data that I shared was really a snapshot for the month of February. So since the summer of 2022, we've been able to connect 20 households or individuals to shelter. On a monthly basis, those numbers are significantly lower. I'm looking at the report now. It looks like we were able to connect a total of 5 individuals to shelter. And to answer the second part of your question, we serve both unsheltered and sheltered individuals. So we have referrals that come in from a variety of sources. Our Sonar team is out on the street trying to identify those folks that are unsheltered. And so there's a lot of contact there and engagement there. But we also have referrals coming in from across the community, whether that be from the interfaith community, our food banks, or the schools. So we're working to serve really anybody that is unsheltered or homeless in our community.
Thank you. And so I'm curious, are you serving as the regional resource, or is this just for Avondale? I know sometimes we do more regional things in the East Valley, and one city kind of takes that on.
It's difficult to answer that question. Our resource center functions as a regional center. So we do have funding that allows us to serve those that are outside of our community. But our sonar team is primarily focused on those that are within the boundaries, the geographic boundaries of Avondale. But if we do encounter somebody that lands on our doorstep or connects with us, we're going to do everything we can to connect them to the resources either in their community or wherever we can. We want to make sure that we're serving anybody that we come into contact with. Thank you.
Thank you, Mr. Chair. Those are all my questions.
Thank you, Vice Mayor. They're great questions. Our former fearless leader, Chairman of this committee, Wally Campbell, you're up next.
Thank you. Okay, so my question is similar to what the other folks were talking about. What is your numbers? It sounds like you have thousands of homeless people. So do you do a count every day? I mean, our count is like 20 people and they're just passing through. So we have a handle on it, but we don't have a handle on it because we don't have any services that our city offers, nor do we plan on doing that because we help fund the resource partners that you have in your resource center so that they will take care of our folks. Because
Councilmember Campbell, I would definitely say that our numbers are not in the thousands. Our point in time count numbers historically have hovered around 53 individuals. We've made some significant strides and we were down to, I want to say 43 in the last count.
okay.
So we've been able to shelter numerous folks. And as I'm sure everyone on the call knows, the point in time count focuses on unsheltered individuals. So they're the most visible folks that are out on our street.
Mhm.
Kind of going back to one of the previous questions, each of our communities has homeless individuals that want to remain hidden. And so they couch surf and rely on their network of friends and family members and neighbors to keep them housed.
Right.
So no, our numbers are not quite there. We're just very proactive and want to make sure that we're getting ahead of it. And our community has definitely had a compassionate heart for service for many, many years. And so even though our numbers are relatively low, we want to put every effort into making sure that we can serve those folks in our community.
All right. So for your bridge housing, now, is this going to be temporary housing for a family until you can get them into permanent housing? I don't quite understand what the bridge housing is.
Yes. So the concept is really to identify families that are from Avondale, connected to our Avondale schools, and make sure that those children are still connected to their schools, that mom and dad are connected to employment if they have that. And those families would typically be in our bridge housing units anywhere from 3 to 6 months as we work to get them into other housing solutions.
Okay, very good. Well, we appreciate the partnership that our city has with your resource center, and we're all working for the same thing. We're trying to keep folks housed and off the streets as best we can. So thank you very much, Chris, for the presentation.
Thank you.
Well, you always provide great feedback. Thank you for that. Vice Mayor Klein?
Hello, and thank you. I'm only council member this year. We handed off the vice mayor to someone else, but thank you.
Well, I'm gonna have a top mayor then. Go ahead.
Just to let you know, first of all, congratulations to the city of Avondale for what you guys are doing. I'm not sure if our resource center and your resource center are talking to each other, but we're doing very similar kinds of things. One of our situations are transition housing. We're going to have a 30-day transition housing that should open by June. It's being run by a New Leaf, which is one of those partner organizations that many of us use. And it's located centrally, which will also allow us to have an input location to document putting people into the system. That's something that we don't have enough of on the west side of town. I think Avondale is probably the closest location where we can take folks to. And a lot of times people end up all the way down in downtown Phoenix in order to get them into the system. So our police folks, we don't have a huge contingent of police folks, but the idea of this it's a motel with 7 bedrooms. Sorry, that's me. 7 not 7 bedrooms, but 7 units in the motel for women and family predominantly, to get folks off the street, help them get the resources they need, whether it's job training. So we have we're working with Maricopa County's AZ at Work program in our resource center, as well as folks that are doing GED programming and things like that to help folks, as well as working with Homebound, which is the new 18 to 24 transition housing that we have already opened. It's actually being run by another organization, but it's right in Surprise, focused on foster young folks, but not exclusively foster kids. It can also take young folks who are on the street who are looking for as much as 24 months to get what they need to get them trained and back into productive work and being able to help them find housing. So thank you for what you guys are doing. And we're right behind you with our resource center and some of our resource programs. So we're working in concert with Avondale and our sister cities, Peoria, and everyone who's right around us. So I just wanted to thank you for what you're doing and let you guys know that we're doing similar items out in Surprise. So thank you very much, Gabriel.
Councilmember Klein, thank you for those comments. We work really closely with Seth Dyson and really the whole resource center team there. We share best practices back and forth, and we're thrilled to see the wonderful things happening in Surprise. It only strengthens the region, and sharing best practices is really what we need to continue to do. So thank you.
Excellent. Thank you.
Absolutely. Thank you for that, those questions. I had a couple, one comment and one question. I think the way you are measuring the metrics, right, and you're showing, for lack of a better term, success in the process is remarkable. And I take a mental note of that, and something I'll bring back to the city of Chandler. I know we're doing something similar. I was curious if Kelly, if you could help me get a copy, and maybe others would like to see the copy of your encampment, passionate encampment policy. That's something we'd like to take a look at as well. We certainly want to help folks, but we also know that we don't want to have a situation, and just be frank, that happened down in Phoenix. I don't think that's helpful to the community that evolved there. And I also know that we have some neighbors that are concerned about those things happening in Chandler. So I'd love to see that, if you can get that for me, Kelly, and to the team. All right. Any other questions or comments from the committee?
Chair Stewart,
Yes, Councilmember Duff.
I need to change the color of my hand. It kind of blends with my background. Thank you very much.
Yes.
I just have a few questions, if you'll bear with me. So the Family Bridge housing, I assume that you'll be owning that property as a city and then using a nonprofit like New Leaf to run the facility, to do the wraparound services, to make sure that they're used, in a transitional means.
Yes, Councilmember Duff, our approach is to identify a nonprofit organization to function as both the developer to get these designed and constructed, and then ultimately to provide the operations. We would most likely enter into a long-term lease with the nonprofit organization so that the city retains ownership of the property, but that it's designed and constructed in a way that the nonprofit organization can really focus on the operations.
I see. Thank you. A couple more questions. So the unsheltered encampment policy that Chair Stewart had mentioned, is that a policy that enforces urban camping laws, or what is the general consensus of what that policy is?
Councilmember Duff, it really spells out the process for which we work to clear encampments and our posting process and timeline to make sure that we're doing it in the most compassionate way. There's also some language in there that kind of controls the way we handle personal items and makes sure that we are protecting the personal property of each individual. So there's some mechanisms in there to make sure that it's stored properly and that adequate time is given to individuals to collect their personal items.
So do you allow urban camping?
Urban camping is not allowed in our community, no.
Okay, I see. And then because of the law, then you're ensuring that they have a shelter or a bed to enforce that.
Correct. Lieutenant Bussey, do you want to chime in on any of that?
No, is essentially what you're saying is spot on. So essentially, obviously, the biggest thing is we're just trying to be as compassionate with the people we come in contact with. But as far as, you know, enforcing those policies, we'll do it in the best of our abilities to shed some light onto that and to give those people the adequate amount of time to kind of get those resources necessary to kind of get them sheltered.
Okay, I see. And a couple more questions. Do you do a community court program as far as in your court services?
Councilmember Duff, yes, our city court does work closely with the community court process. The other thing that we're doing is there's a conduit between our courts and our sonar team, so that if there are individuals that are have been identified as possibly being homeless, we make that contact almost immediately just to make sure they're connected to resources.
Great. And then my last question is, so on your sonar program, are those, that's operated by the police department, and are those sworn officers, or no, it's not operated by the police department? Oh, no. Okay.
Councilmember Duff, those are neighborhood and family services staff. So
Okay.
they work collaboratively with our police department, our NROs, our neighborhood resource officers. And so sonar will typically go out and do the outreach and resource referrals. And then if there's any need for enforcement, that happens after the fact with uniformed officers. Very often we will have out of uniform officers in the field with our sonar team. We want to make sure that the presence and the contact that we have is one of generating trust and it ensures respect.
So neighborhood resource officers, is that from a city employee, or is that like from a CBI, or what?
No, so the neighborhood resource officers come from the police department. So we
Okay.
have them, those are
Okay.
sworn officers that we have work here for the PD.
I see. Okay. All right. Thank you very much. I'm just
Okay.
in looking at the things that we're doing and getting ideas on how other cities are doing. I appreciate all the work that you're doing and your patience with all my questions. Thank
No
you.
problem.
Thank you.
Thanks very much, everybody. Great questions.
Chair
Councilmember-
Stewart.
Yes, ma'am.
First of all, I just want to just thank Chris and his team for a phenomenal job that they've done. And he's absolutely right. He has support from mayor and council. And these are discussions that we've had before COVID, since I got on council in 2017. And we didn't have a homeless services division. But as we know, the increase of our unsheltered population in the West Valley, Chris and his team, PD, I mean, they took it upon themselves to develop this division that really addresses most of the needs, whether it's employment, whether it's mental health, whether it's substance abuse. And I couldn't be more proud of our team for doing that here in the West Valley. And as our West Valley continues to grow, those needs are going to continue to grow. And so I'm also thankful for the city of Surprise and Seth Dyson and their team for what they do, because I know that they work closely, and it's kind of neat to see them coming to our city, us going to their city, so that we can each kind of see maybe what some of those gaps are that we can each do something to help serve that unsheltered population. But again, I just want to thank you, Chris, and thank you, Lieutenant Busi, for joining in on the call, for your presentation and for answering questions. And again, thank you all.
Thank you.
Thank you. We're going to move on to item number 6 in our agenda. The Federal Transit Administration Section 5310 program provides capital assistance to improve mobility options for seniors and individuals with disabilities. Over $5.4 million is available for the fiscal year 2023. On April 26, 2023, the MAG Elderly Persons with Disabilities Transportation Act Ad Hoc Committee developed and recommended priority listing of the projects for the FY fiscal year 2023 Section 5310 program for the Phoenix Mesa urbanized area. We've got a presentation, and then at the end of this, we would entertain a motion to move forward for all the participating members, if we would like to use this recommendation from that ad hoc committee for this funding. Thank you.
Thank you, Chair, members of the committee. My name is Didi Castilla, and I am the Human Services Transportation Program Manager at MAG. And again, yes, so Section 5310 Enhanced Mobility of Seniors and Individuals with Disability Grant Program does provide funding available to support transportation services to meet the needs of older adults and persons with individuals with disabilities when public transportation is insufficient, unavailable, and inappropriate. Next slide, please. This is a federal awards program. We do receive apportionments to the Phoenix Mesa urbanized area. Eligible applicants are private nonprofit organizations, public agencies where no viable private nonprofit organizations are available, and tribal governments. The eligible population are agencies serving adults over 65 and agencies serving persons with disabilities. In 2014, the MAG Regional Council recommended and the governor approved MAG to coordinate and program the Section 5310 application process with the City of Phoenix as a designated recipient. Next slide, please. The EPDT committee reviewed all 39 applications from 25 agencies within our UZA region. MAG and the City of Phoenix conducted a 2-week internal review to ensure all applicants met federal requirements and regional eligibility threshold. Evaluation was based on criteria if the applicant had the capability and experience to perform the requested project, they met the program objectives, the budget was appropriate to the project, and the participation in regional coordination efforts has federally required. For the Section 5310 program, not less than 55% of the total apportionments are to go for traditional capital requests, such as equipment, vehicles, mobility management projects, which also includes a 10% program administration fee. To move forward into the awarding phase, an applicant would have to have attained a 70% threshold. And the priority listing is based on the final ranking of all applications. The priority listing was provided in your materials today, and I'll provide an overview of what that reflects. 24 agencies and 38 projects. One agency was not recommended to move forward for awarding based on not meeting the 70-point threshold. Our federal apportionment is 5.4. Our total project request was 4.1 million. And then including the 10% administration fee of over 500,000, our total federal request is 4.6. We will have a carryover to 2024 of $740,022. Last year, we also had a carryover, but that was drawn down by the cost of the procurement of vehicles. We did see a really big increase in vehicles. Last year, we estimated vehicles, cutaway vehicles at 86,000, and when we went to procure the vehicles, the cost of the vehicles was about 120. So we estimated vehicles to be about 125,000, which is quite a big jump. The priority listing will move forward to the MAG Management Committee for recommendation and to the MAG Regional Council for approval to forward to the City of Phoenix to develop the consolidated Section 5310 application to submit to FTA. And again, for your information, vehicle costs are estimate until final procurement. We are requesting committee action to recommend the approval of the priority listing of projects for the fiscal year 2023, Section 5310 enhanced mobility of seniors and individuals with disability program for the Phoenix Mesa urbanized area. This concludes my presentation. If you have any questions, thank you, Chair and members of the committee.
Thank you very much. It's an outstanding presentation, and we appreciate your thoroughness. Do we have any questions or comments from the committee? Okay, hearing none, I would like to take a motion to approve the priority listing of all projects within that presentation for the fiscal year 2023, Section 5310, Enhanced Mobility of Seniors and Individuals with Disability Act program for the Phoenix Mesa UZA.
I move we accept it.
A motion by Councilmember Campbell.
Councilmember Condi, I second.
And Councilmember Condi with the second. Without any further questions, we will take a roll call vote. You know what? We can do a voice vote. I don't think there's anybody going to be having too much challenges with this. So let's just do a voice vote, please.
Aye.
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 Motion passes. Thank you. We'll be recommending that to the Regional Council.
Thank you.
Thank you for the presentation again. We'll move on to item number 7. Vitalist Health Foundation believes that housing is health, and I think we could probably all agree on that after the presentation from the YWCA today. Housing has the power to improve health outcomes and enhance community well-being. Vitalist MAG and the Arizona Community Foundation hosted a webinar recently to give an overview of some of the practices outlined in the Promising Housing Practices in Arizona publication. Suzanne Pfister, the president and CEO of Vitalist Health Foundation, and Gabriel Iramello.
It's a tough one. Jaramillo.
Thank you. Vitalist Director of Healthy Communities will present on this work and next steps that can be taken to increase the affordability of housing regionally. We are ready for the presentation. Thanks very much.
Thank you, Chair Stewart and committee members. I think I'm the last presentation, so I'll try to run through these. Again, my name is Gabriel Jaramillo. I'm the Director of Healthy Communities with the Vitalist Health Foundation. I oversee our programmatic work in housing throughout the state and helped create this Promising Practices presentation. I know Suzanne, our CEO, did the presentation a couple of weeks ago as well, and we've been promoting this in partnership with MAG with a couple of the webinars that the chair had mentioned. So thank you again for having me. We'll move to the next slide, please. Vitalist Health Foundation, I was happy to see the elements of a healthy community mentioned earlier today. Vitalist is a big advocate for the elements of a healthy community and the social determinants of health and how they interact for the design and promotion of health for individuals in any community. Next slide, please. Thank you. We'll touch base briefly on this. I think everybody knows there's a housing shortage. It's been talked about a lot. Depending on who you ask, we hear numbers from 40,000 to 270,000, depending on who you ask. We know every county and every city is facing a housing shortage in one way or another, either affordability or lack of housing. Interest rates have increased, value rates have increased, supply chain issues. So we're all familiar with the housing crisis and everything that's going on. And everything that's caused rents to increase and sale prices to increase. Next slide, please. All right, this is just a quick little diagram that we put together, we threw together here. Actually, we found some great information that kind of outlines the need and the circular motion of demand and shortage supply and increased costs. Next slide, please. Again, further instability, we talk about rental prices increasing drastically. The most recent statistic I heard when we talk about rent burden families and households that pay more than 30% of their income towards housing. We heard more than half of the families within the greater Maricopa County are paying more than that 30%. So we have more than 50% of the families in a cost burden situation for their housing. So that just continues to add to the strain on families to make decisions on health and education, transportation, other aspects. 23% increase on homelessness, and we can go to the next slide. We talk about the entire spectrum. I'm glad there was presentations on housing the unhoused and those moving into shelters and the health implications that it has for that. We can go to the next slide. We understand that past legislation has kind of set some of the, I guess, relationship between the state agencies and our local governments on how to address housing, whether it be through the unregulated short-term rental processes or the elimination of the percentages requirement for affordability. We understand that there's a lot of complexities. Now we're seeing different different bills at the state level, whether it be 1161 or other by right zoning that have caused conversation to get brought up about the types of zoning and other types of practices that states requesting as opposed to allowing local governments to be able to process that. Next slide. So this one we can't take any credit for. Elliot Pollock kind of put this together, outlining the economic driver and the economic implications of housing. Affordability is just out of reach now. He highlighted it the best when we talked about the affordability for working class individuals no longer being able to afford your average 1 or 2 bedroom apartment. And he showed the transition from 2 years ago to this year for those that can't even afford ownership into that working class. And we're talking teachers, police officers, firefighters, and that, entry level salary range. So it's become an economic driver. Again, this is not new information, but it was really highlighted well in Elliot Pollock's presentation. Next slide. So this is where Vitalist, I'm sure many of you have heard, Vitalist has been working on housing on school properties, and we'll highlight that process a little bit later. But we really started hearing about how to increase supply, how to increase the variety of housing to affect affordability. And we were looking around the state, we were approached by several organizations that, hey, we're already doing this, this is one of our options. So we started cataloging that, and that's what kind of started this promising practices Spark report. So you can see that you have our website there. It's on our website, and I have printed copies if anybody would like. We can go to the next slide. But it really is just to highlight some of the things that are already going on through a variety of innovative practices. So accessory dwelling units and mixed communities, pictured there is the choice neighborhoods in Central City South that was selected as a choice neighborhoods, which is a mixed income neighborhood. Not only mixed income, but mixed use. So it has not only community sites, but has rental and for ownership opportunities, all affordable home ownership in partnership with Trellis and a couple of the other affordable housing builders. Gorman, I believe, is building this one. But we have other examples like Guadalajara and Tucson, which is an ADU builder, a tiny home builder that's trying to work with families now that Tucson's passed their ADU ordinance. And there's several other cities that are working on that. But those are things that are currently going on right now. We'll go to the next slide. So co-location examples are other really good examples of other types of development. Councilmember Condi, you mentioned Surprise. The picture shown there is actually from Seth. We're really excited about the multi-generational resource center, and you can see housing on the background there. So they're talking about coupling not only resources, but housing for seniors around that community to really create that co-location of services and housing that addresses a variety of needs. First Place is also one of those examples that brings a co-location feature with housing and wraparound services. And New Mom's been known for that as well. We think there's an opportunity to expand on that throughout various cities as well. Next slide. So when we talk about co-location, we've heard, I believe, Chicago co-locates housing with libraries and other city infrastructure developments, whether it be firefighters and police stations, But there's also opportunities. We're hearing expansions of strip malls that are incorporating housing in some of their density for light industrial and business centers to incorporate housing above that. I believe out west, we're hearing Costco will be the anchor for the community with mixed income housing above that. So we could see a mix of co-located opportunities there, city parks and senior centers. You know, Vitalis is in conversation with not only federally qualified health clinics, but new opportunities for those health clinics, specifically targeting seniors to bring in senior housing on top of that FQHC. So you have residents that are participating in those, receiving services from those federal qualified health centers, living above their doctor's appointments or whatever that may be. So there's great opportunities. When we talked about our housing on school properties, many of the teachers have families. So we talked about co-locating either a child care center or workforce development center, healthcare clinic, along with that to anchor that type of development as well. Next slide, please. And I know several of members of this committee are working with Newtown or have Newtown properties within their cities, but really the expanding of land trust to talk about permanent affordability or affordability in perpetuity when it comes to either ownership and expanding that process. So we're in communication with both Newtown Community Land Trust and the Pima Community Land Trust to see, what are the capabilities that they have to incorporate new parcels of land to ensure affordability for the long term. So that's another great option that's already doing great things. In fact, that little picture to the right is the Newtown, is one of the first drawings of the Newtown. They're already up and running, but that's in Tempe as well. So it's an amazing project. That's mixed income, so it's got a great opportunity for to be replicated as well. We'll go to the next slide. And then we talked about creative building technologies, 3D printed homes. Luckily, I was with Habitat for Humanity, Central Arizona at the time that the 3D printed home was constructed. So pictured there, that's all cement exterior that was printed on site by a 3D printing apparatus that brought in a proprietary blend of concrete, fiber, and polymer to create this home. I mean, it was a really amazing project. We talk about Zenny homes, container homes, Hercule walls, which are prefabricated walls and they're assembled on site. Boxables is another example. We've seen a lot of other opportunities for various types of housing that address affordability and the variety of housing as well. So we've seen these already in place, and these are already happening as we speak. So we're really excited about that. Next slide. I talked a little bit about our housing on school properties. That's another report that we came out with, Vitalis came out with about a couple of years ago. And we're working with various school districts throughout the state, some urban, some rural, to see how they could utilize property to address retention rates for teachers and find housing for new incoming teachers and retain teachers that are that need that extra and either are traveling too far or would like to stay in the area. So we're working with a variety of cities and IDAs to see how we can best utilize that. We're partnering school districts with developers, currently with affordable housing developers, to help walk through a plan and create development plans for use of their land to address the need, and working with the teachers and staff to identify the highest need. So this is something we've been working on for a couple of years, but is a great opportunity for when we talk about land use and land use opportunities. We'll go to the next slide. Faith-based partnerships is something else that we're going to be going in a little deeper with recently. We've highlighted a couple of these groups in our quick takes in our report. Rehoboth Place is building off of Indian School and 27th Avenue. We talk about UMOM, United Methodist Outreach Ministries, and their footprint throughout the valley has been amazing. So there's a lot of opportunity to work with churches. We've had churches reach out, and as of even the previous administration, Director Simplot was working with churches to see how they could address housing and use the services that they already have in place and use land that they currently have that's underutilized to house individuals in different capacities. So that's something that's growing as well. Next slide. So we talked about a couple of incentives, ADUs. We know there's a lot of conversation around ADUs, even in the legislation, reducing parking requirements. These are all aspects that, you know, MAG and the League of Cities have are already in conversation with, but we just want to keep highlighting these, streamlining development processes, using public land for housing. Again, that co-location aspect when we're talking about the creation of a new library or fire station or police station or whatever that may be, municipal building and co-locating with housing. We've seen that work in other cities. So it's a great opportunity, rehabbing units for deed restrictions. So when talking about senior housing or individuals with high needs, whatever that may be, there's a lot of opportunity there as well. We can go to the next slide. And then we don't just leave suggestions. One of the other things that we just updated, Vitalist came out with this report originally about 4 years ago. We've since updated to highlight various types of funding mechanisms that are available for that. So we're working again with school districts, developers, municipalities, for-profit, nonprofit developers, and other organizations that are trying to find ways to address housing. And here are some of the resources that we've been able to compile to get together to show what's available along the entire spectrum of housing when we talk about either transitional temporary housing all the way to home ownership, as a way to, you know, break generational wealth through ownership, but along the entire spectrum. And it's broken up into we have it broken up into two different slides here when we talk about federal funding, government funding, and other private types of funding as well. So we go into private activity bonds, industrial development agencies or organizations, community foundations, some of our local foundations as well. So that's a great resource that's also located on our webpage, our housing webpage on Vitalist's website. Next one. And then there's the narrative going on. I know Home Matters has launched a campaign, Home is Where It All Starts. And there's a couple of other groups, Home Arizona, to really address the way housing is discussed when we talk about housing. A lot of the time NIMBYism comes up. So really working with residents and educating individuals about the need for housing and how it can fit within various communities, and just going out and having that communication. And you know, a lot of the times the word affordable housing is an immediate trigger for certain groups and communities, because they, you know, picture back to the days of, and I hate to say it, but a project or whatever that may look like. But when we look at new developments, Native American connections in UMOM, you can't distinguish them from, market rate housing developments and everything that goes on with them. So really diving deep with residents and communities to talk about housing and what the impact it has for them, and then bringing that up to support for new developments. So there's a couple of organizations out there that are looking to change the narrative and provide support for housing developments. Next slide. That I saw a flip. All right. So I guess this is what it kind of comes down to, and what we hope to work on. And we're looking as an organization, Vitalist works throughout the state. We would really like to work jointly with members of this committee and MAG to look at new ordinances, whatever that may be, that are driven by the cities and the municipalities that are working closely with the community. If there's a way to look at writing model ordinances that will be similar throughout the region when it comes to addressing maybe ADUs, to find I don't want to say uniform way, but find very similar language. So when it comes to implementation and finding financing for those, it's pretty easy for residents to be able to find financing or capital opportunities to fund ADUs or additions or whatever that may be. So what we're looking to see, that would be our request, is to, and Vitalist is willing to partner with any city to create these model ordinances. I work with the city of Phoenix regularly to help create, guidelines and whatever that may be through general plan updates. But we could see different, we have different opportunities here, whether it be through the general plan modification, supporting financing through social impact investing, which is something else we're looking into. We don't want to just recommend modifications. We want to look at activating investments, capital investments to fund some of these projects. When we talk about affordable housing, one of the most difficult aspects is funding them. So we're looking at various opportunities for that as well, not only in the report, but future ways as well. Let's see here. That is my last slide. I try to rifle through those as quickly as possible. I know we're over time, but I'll open it up for questions if anybody has any questions, comments, concerns.
Thank you, Gabriel. Any questions from the floor? Comments? I know we're right up against time, and I know that housing is one of the pressing issues for all of us. And I appreciate, Gabriel, that I think Vitalis has been very good about not calling our neighbors names as it relates to these projects. That's something that's really been unfortunate during this time. Let me ask you a quick question. We have about 1,800 units going back about 4 years that are just kind of still sitting, waiting to be built as it relates to, are you seeing any updates or any changes as it relates to materials or supply chain or actual just the number of builders that can help us increase the inventory to hopefully create some solutions to some of these housing issues? We keep getting a lot of these, we want policy changes, but when we did a deeper dive across the valley, cities like Gilbert, cities like Avondale, Glendale, we have products that we have approved, high density projects that have yet to come out of the ground. What are you seeing out there as it relates to that?
Thank you, Chair, for the question. I think for what we've seen, and we've seen a couple of presentations, I believe Elliot Pollack talked about the supply chain, and it's really mixed. The last survey of developers, when asked about the supply chain, it was a mix across the entire spectrum, talking about the incoming product, whether it be lumber, technology, metal, whatever it may be. Some are saying that they've seen a huge increase of that it's coming back to normal, all the way back to they're still struggling to get basic material. So it's tough to say where they are. For the majority of the developers we've seen, at least when we're talking about lumber and other development material, those have pretty much come back to normal production. Now prices are still extremely high for those. So price hasn't changed as much. They haven't seen the drop in price. So that's kind of led to some of that, which has changed some of the scopes of work for those developments or the performers there. I think technology is one of the biggest hindrance for that. We've heard some developments that are waiting for microchips for heating units for entire multifamily development. So technology seems to be one of the bigger bottlenecks right now, but it seems like the building material, at least from what we've heard, is back on track, although at a higher rate than it was before.
Well, that's certainly good news, and we appreciate your working with the Arizona League of Cities and with MAG. I think some of the things that are happening at the legislature that are a little bit of an overreach as it relates to our zoning laws, we're doing the best we can at the city. So we appreciate the Housing Coalition, your help and Elliot's help in sort of sharing that narrative for us. So we hope you continue to do that. Any other comments from the floor? I know we're up against time, folks. Sorry to steal the end of it here.
Chair Stewart, this is Councilmember Condi.
Go ahead.
I was just wanted to request if we could get that PowerPoint sent over to us, that'd be great.
We would be happy to share all materials from today, including the compassionate camping policy from Avondale as well. We'll make sure that you get all of that. Thank you.
I'll second that.
Super. Great idea. So, hey, we're going to move on to item number 7. Gabriel, thanks so much. We appreciate your time and great presentation. It's always good to get that information. I think moving forward for requests for future agenda items, obviously homelessness and housing is going to be a key topics. I will leave that up to Vice Chair Condi, incoming Vice Chair Condi, and Chairman Navarro for what they're going to put on their next agenda. And for the sake of time, we'll do some emails back and forth. Kelly will send out some recommendation on that, unless there's something pressing that somebody would like to get on the minutes. All right, super. Any comments from the committee on number 8? All right, y'all. Hey, again, thanks so much for your support and for your attendance, for everything you're doing in your community. I've been honored to serve over the last couple of years. I'm really excited to see the fresh ideas and fresh blood coming in from Councilmember Conde and our new chair, Jill Navarro. So thanks to everyone. I'll see you guys out at our events. And with that, I'll take a motion to adjourn.
I'll make a motion to adjourn.
Wally's faster than me.
Get Wally in the minutes. Thanks, everybody. Motions, meeting